Hi there, it's Dr. T here. I'm so glad that you're here to learn more about direct care podiatry, a better way to care for your feet. I know you've taken some time out of your day to learn a bit more, so I'm just going to jump right into it so you can see the value of continuous care through the membership model that I now offer in my practice. So let's get straight into it. I've been in practice here in Santa Cruz County for over 6 years, and patients come to me saying things like, I worry about waiting too long between appointments. Others say, I need somebody who really knows me. While others say, I'm tired of being rushed through my doctor's appointment that took me so long to see. And with that, I just want you to know that you're not alone. A lot of people are experiencing this type of way of medicine where it feels impersonal, or it takes a long time to be seen, or simply there's just not enough time to learn about all of the things that's going on with you in regards to not just your medical condition, but what else is there that you can do to be more proactive in staying healthy. And I am also a patient. So when I see my doctors, who oftentimes are also my friends and colleagues, I don't ask for special permission or any special treatment, but I do see that this type of medicine is very distant. And so you're not alone. And I know the problems in healthcare, and I'm going to elaborate a little bit more so that you realize why a membership is actually much more beneficial in the long run. Some challenges you might be facing in your current situation might be that you're waiting too long to see the specialist, or you worry about something going on and it needs attention, but you're not quite sure if you need to go to your doctor, or you need to go to the emergency care center or the emergency room. You're not really sure. Or you go into Google and then you find a bunch of information that ends up distracting you, and then you end up not going to the doctor for medical attention. Or you're in a situation where you have some coverage, but there's only a few, maybe twice a year you get to see the podiatrist, and so you're rationing your visits and maybe not getting the best care. This is the biggest problem I see in healthcare right now, is that patients don't know what things cost, and so they end up getting an unexpected medical bill at the end of their visit, months after that visit. And that can be very alarming, especially when you're not financially prepared to know what the things are going to cost. So dealing with unexpected bills is very typical in medicine right now. And all of those issues that I brought up have a huge impact on your life. It's that uncertainty of when you seek care, or you end up delaying medical care, or it's that unnecessary stress about what things are going to cost, or if there's going to be coverage with your insurance. And then there's that worry that you might develop a serious problem, but if you have to wait so long to be seen, you're worrying in between the time before you see the doctor to get some clarification. And of course, the frustration of just having limited access to your doctor, whether it be how long it takes to see them, or when you call the office, you're trapped in a phone tree situation. Messages are passed from people to people, and it feels like it takes forever to get the doctor to call you back. So that can have a huge impact in your life. But what if I told you that there is a better way to get medical care for your foot and ankle issues? Imagine having a podiatrist who is available when you need them. You send them a text, an email, a quick phone call, and they're there with you, helping you along the way with your medical issues. What if you don't have to worry or count the number of visits? There's no longer rationing or watching for the calendar, waiting for that next appointment to show up. What if you can be seen sooner instead? Or you meet your doctor and they truly know what your needs are, what your history is, and you don't have to continually revisit your past because this person has been with you for a long time. What if your doctor provides you this level of peace of mind because they are offering regular checkups? So that way, if things show up in between those appointments, you can easily communicate those issues with your doctor. And what if you knew the cost of everything so that you never had to deal with a surprise bill later on down the road, or worry about coverage issues or have coverage debates about what the doctor recommends? Well, that's what I want to share with you today. So my objectives for you is to help you understand common issues that occur with aging in regards to the foot and ankle and the problems that we have in our healthcare system, and some of the strategies that I have here for you to help give you peace of mind. And if you stay until the end, I'm going to show you exactly how you can schedule a free call so that you can learn more about this program and see if it's a right fit for you. If we haven't met, I'm Dr. T. Nguyen. I'm a podiatric physician and surgeon. My training included 4 years of podiatry school in which I earned the degree DPM, Doctor of Podiatric Medicine. I learn alongside colleagues with MD and DO degrees as well. I am a problem finder. I see lots of problems. I try to find the source of it. I'm also an educator. People invite me to their conferences to speak amongst big stages so that I can teach them something that I know. And all of that training accumulates to 8 years of medical training, plus an additional elective fellowship year that I took on to help people with diabetes prevent leg amputations through wound care surgery. Why is anything I share with you important today? After I have performed a lot of preventable amputations, especially during my fellowship year, and many procedures along the way, patients are often saying something like, I didn't know how important my foot health was, or I didn't know I was supposed to see a podiatrist. And I believe that people deserve to have options and understand what foot health really entails. It doesn't mean that you see the doctor only when things hurt or only when things are half falling off. And unfortunately, I have patients who go to the emergency room as their primary care option because they don't have access or easy access to their doctor. That ends up racking up their bills, that ends up delaying their care, because how often or how quickly can you be seen in the emergency room when it's packed with other people trying to seek solutions to their medical problems too? So this is something very interesting that I found in Medicare documents that says care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. So what this means is that what your doctor recommends and believes is best for you is not always going to be the thing that insurance will pay for. They can't pay for everything, right? They're still a business at the end of the day. And so realize that these are different entities. When your doctor recommends something, but the insurance comes back and says they will not pay for that, that kind of puts you in a sticky situation where maybe you have to pay out of pocket, or maybe you feel like there is no other option, and so you don't go for that recommendation. And that can delay your health, your care. And that's to say this, corporate medicine is where we're at right now, and a picture may better illustrate what the situation is as to why people are dealing with a lot of these issues in medicine. And that's because when you put insurance in the mix, it's like having a third party in the exam room between the patient and the doctor. For example, a patient comes in, maybe he stepped off a curb, not sure if he broke his ankle, but needs medical care. It's not bad enough to go to the emergency room, but it's painful enough to want to know what's going on. So the logical thing is to pick up the phone to call the doctor. However, if you want to use your insurance, you have to call and figure out who takes that insurance, right? So maybe you call the number on the back of your card to find out what specialist takes your insurance, and these people give you some information, then you go to the doctor, and then you finally get to the doctor, which could take 3, 4, 5 months to be seen. But you finally get there, and maybe you're seen on time, maybe you're not, depends on whether or not they're behind, but you get the care that you need from the doctor. The doctor continues to give you recommendations that may need insurance to pay for it, physical therapy, prescriptions, additional imaging, and so on. So that doctor also has to go through that third party, that insurance plan, and ask permission to get those things paid for. And many times they can say no, or they delay the care. You have to wait until they get the authorization to prescribe those things. And so there's a lot of things in between the patient and the doctor that ultimately ends up delaying medical care. So it's frustrating for the patient, they're not getting better, and it's frustrating for the doctor because things are getting in the way of trying to take care of that patient. And that's corporatized medicine. That's what we all have right now here in America. And I want to share with you what direct care actually is. This is the model that I have. And direct care is like the farmer's market of medicine. So you want some organic eggs? Where's the best place to get that? the farmer's market, right? Why is that? Because the money you pay the farmer goes directly into their farm and they are able to produce organic eggs. It's direct to farmer or direct to consumer. We take out the people in the middle who are also trying to grab that profit, and all that money goes to the farmer so that they can reinvest into their business and give you quality eggs. Direct care, exactly that. It is the doctor that you have direct access to, where we don't have to deal with the middleman. We take that out of the equation. So if you have a problem, you pick up the phone and you say, I'm not sure what to do. A direct care doctor can say, let's evaluate over the phone, or let's evaluate by a video visit, or why don't you just come in so I can take some images in the office. And that allows us, the doctor, time to spend time with you, to get the imaging that you need on site. This is collaborative care. You get immediate attention, and you pay the doctor directly, which can then be reinvested into making systems a little bit more easier for patients to experience. So in both situations, direct care and the farmer's market will remove the middleman to improve the quality of care that we deliver. I'm not sure if you know this, but 1 in 4 adults aged 60 and older will experience foot problems that impact their mobility and their day-to-day activities. And because my background is in helping people with diabetic foot ulcers heal, this was very interesting. The longer we live, the more problems we accumulate, it seems, right? And diabetes is one of those things that the longer you live, the more complications that the person is likely to experience, including peripheral neuropathy, which is nerve damage or numbness in the hands and feet, heart disease or peripheral arterial disease, kidney disease, and vision problems, retinopathy. And those individuals are at a higher risk of losing a leg. Why is that? Because they don't have access to preventive care, which is why the treatment in preventing catastrophic, irreversible problems is preventive care. And that's what I'm here to share with you. Other problems that show up in the aging feet include the following: toenails that get thick, they get ingrown, they become weak, they become discolored. Other issues like skin cancers can show up, developing skin disorders, athlete's foot, dry feet, dry skin, open wounds, calluses, warts, aches and pains, a condition called fat pad atrophy, where it feels like you're walking on skin and bones because we're losing cushion on the bottom of our feet. There's also delayed wound healing, so you get a cut, it doesn't heal as fast as it used to. Or tendons get weak, and so it makes it really hard to walk and do your usual activities. And other issues, imbalance issues, circulation problems, and so on, right? Difficulty with self-care. It seems like the older we get, the further our feet is from us. That's what patients say to me. And so wouldn't it be nice if you had somebody on speed dial to help you when these things show up? The best treatment is prevention. It's knowing how to take care of yourself. It's having that doctor on speed dial. And it's followed by early detection of issues by an experienced podiatrist to know how to treat it. And so this model, direct care podiatry, is just like having a podiatrist in the family. You call them, you email, you text, and you get a response. You get regular attention for your concerns. This is a prevention-focused type of model because we know that it's missing from traditional options. And it's somebody who knows you, your whole story, and not just what your feet looks like. So it's a holistic way to take care of people. So let's talk about the membership program. This program is here for when you need us. So that means that you can see us as often as you need. You don't have to ration your 2 visits per year, but you can get up to 12 visits per year instead. You have direct communication with the doctor and regular checkups so that we can catch things earlier rather than waiting for it to get really, really bad or even potentially irreversible. The members that I currently have love these things. They love that they don't have to second guess. They don't think they're bothering us anymore by calling us at whatever time that they need us. It's nice to have that peace of mind. They have relief knowing that it's easy to come in as needed, or if they're worried about something, or if something new showed up. And they finally feel like somebody is looking out for them, which is what I love as well. A couple of patients that are in the membership program. Mary, she states she used to worry about her diabetic feet because she had family members who had undergone amputations in the past, and she didn't want to have that lifestyle. So she was very proactive, and she was very well aware of the importance of foot health and needed a little bit of help from a podiatrist to guide her along the way so she wouldn't end up in the same situation. She did have insurance, but she wasn't able to get appointments when she needed them, or when she got to those appointments, it was very quick, it was very rushed, and it really didn't give her the time to understand what she could do to empower her to take care of herself. And of course, that left her stressed about those limitations she had. And now that Mary is a member, she gets her regular checkups, and she calls us whenever something new shows up, or if she's concerned, or if she has a question. It's easy to email or pick up the phone. She has our direct number, and now she feels confident about her foot health and doesn't have that anxiety about accessing foot care, because she, like many of us here, enjoys things like walking or going to her Zumba class or doing exercises with friends. These are all things that are very important to your mental health. And now that she has the support here, she can continue on with that with less worry. Another patient who is a member, John, he is somebody who is at risk of losing his leg. He was referred by the Wound Care Center, who knows that I provide preventive care. And he wasn't sure if what he was experiencing as far as his wounds, if he was healing, if he was on the right path, and if there were other things that could be done to prevent catastrophic issues. So basically, he just wanted additional support. And when John did get admitted to the hospital, he continued to have access to me and get that reassurance in regards to all of the medical jargon that he is hearing, or the new medical team that he has in the hospital is different from what he normally gets outside. And so having that ongoing care, that continuous care, gave him peace of mind so that he can be relieved when a doctor said something, and he can truly understand and fully consent to that treatment plan. And then lastly, Tina, she's a patient who undergone successful treatment of cancer, but she is still at risk. She's within a window where the slightest infection can really cause big problems. So she's having more difficulty bending over, which is normal as we get older. She doesn't have a lot of support at home, and she worries about these infections that show up because they tend to spread rapidly. And she's known to be a slow healer. So she is somebody who's enjoying the membership because she doesn't have to worry and wait on that next appointment that's 3 to 4 months down the road. She can be seen within 24 hours or get managed virtually, or just be able to call me directly. And so she gets that peace of mind as well. So what do they all have in common? This is a simple, stress-free way to get foot and ankle care, because remember, 1 in 4 aging adults will have foot issues that inhibit their ability to be independent, to do their day-to-day activities, and so on. And this membership makes sense if you feel at ease with having that fast access to expert care, or you need additional support in your health, or you need and have ongoing issues, complicated issues, lifelong issues like rheumatoid arthritis or cancer, or you've successfully been treated for cancer and you're in recovery. Diabetes, I've mentioned, circulation issues. If you have difficulty in self-care, or you simply just don't know how to take care of your feet and you want to have that access, this is a great option if you have insurance and your insurance doesn't provide this level of care. We call that underinsured. And if you don't have insurance, or you lose your insurance, we're still here. It will end up being your decision on whether or not you want to invest in this for yourself or a loved one. So what does the membership actually include? It includes all of your visit for the year. You get priority scheduling when you need us. You'll get those regular checkups. You get direct access. You will not get a surprise bill because you will know exactly what things are going to cost before treatments are rendered, which gives you peace of mind. You don't have to doubt anything about your health anymore when you have that level of care. So we deal with whatever we need to deal with to get you what you need. Without the insurance in the way, there is no complicated paperwork other than the registration forms. There's no insurance prior authorizations. We don't have to wait for approval. You just get straightforward care when you need it. And again, if you lose your insurance, we're still here for you. You're probably wondering, what does this actually cost? Well, I made it very easy to join, and it's incredibly affordable. At only $250 a month, you get monthly foot care visits to have your nails trimmed, your callus reduced, applied medical grade moisturizers in your visit, and a comprehensive overview of your foot health at that visit. It's like having a podiatrist on call. If there are other things that show up, you have access to email, to texting, to video visits as needed, and ultimately you get more frequent checkups. You also have access to advanced treatments, like we have low light laser therapy for aches and pains. I had an example of a patient who came in with a sprained ankle. She comes in for her monthly visits and says, by the way, I hurt myself here. And what do we do with that? We provided her with a treatment using red light laser therapy, and at her following follow-up, she said it felt much better. And so you get access to advanced treatments like that with your membership. You also get priority appointment scheduling, and if urgent care is needed, we're there for you. So now I want to ask you, are you ready for peace of mind, foot and ankle care? Because it's time to give your feet the care that they deserve. You made it this far, and I promised you that I would show you exactly how to book a free initial call, and it's so simple. There's a button down below that you just click on and put your information in there to request a free initial call. When we meet, we're going to discuss what you're going through and talk about what you've tried to address your health concerns and ways that we can help. Then at the end of the call, you will get a plan of action to prepare for your first appointment. I hope you're excited to know that concierge level care is right at your fingertips, and it's up to you to decide if now is the time to invest in your foot health. I look forward to chatting with you more. Thank you so much for taking the time for being here with me. We'll talk soon. Take care.